Hello everyone, now let us discuss about CPT coding guidelines for surgery, musculoskeletal system part 2. In the current session, we will be focusing on the CPTs of head, neck and thorax, back and flank. Now coming to the CPTs of head. The first CPT is 21010 which deals with orthotomy of temporomandibular joint. The next is 21011 which deals with excision, tumor, soft tissue of face or scalp, subcutaneous less than 2 centimeters. The next is 21012 which deals with excision, tumor, soft tissue of face or scalp, subcutaneous. Here the diameter of the tumor is 2 centimeters or greater. The next is 21013. So it deals with excision, tumor, soft tissue of face or scalp, subfacial, less than 2 centimeters. The next is 21014. Here the tumor size is 2 centimeters or greater. The next CPT is 21015 which deals with radical resection of tumor, sarcoma, soft tissue of face or scalp less than 2 centimeters. Here the size is less than 2 centimeters, whereas CPT 21016 deals with tumor, radical resection of tumor of soft tissue of face or scalp 2 centimeters or greater. The next is 21025 excision of bone in case of osteomyelitis or bone abscess, mandible. The next is 21026 excision of bone, any facial bone. The next is 21029 removal of contouring of benign tumor of facial bone. The next is 21030 excision of benign tumor or cyst of maxilla or zygoma by enucleation or curettage. The next is 21031. It deals with excision of torus mandibularis. The next is 21032. It deals with excision of maxillary torus palatinus. The next is 21034. It deals with excision of malignant tumor of maxilla or zygoma. The next is 21040. It deals with excision of benign tumor or cyst of mandible by enucleation or curettage. The next is 21044. It deals with excision of malignant tumor of mandible. The next is 21045. It deals with radical resection of malignant tumor of mandible. The next is 21046. It deals with excision of benign tumor of or cyst of mandible requiring intraoral osteotomy. Osteotomy is nothing but, otomy means artificial opening or cutting. So osteotomy is cutting and reshaping of bone. So 21046, it deals with excision of benign tumor or cyst of mandible requiring intraoral osteotomy for locally aggressive or destructive lesions. The next is 21047. Here it requires extraoral osteotomy and partial mandibulectomy. Mandibulectomy is nothing but surgical removal of mandible. The next is 21048. It deals with excision of benign tumor or cyst of maxilla requiring intraoral osteotomy. The next is 21049. It deals with extraoral osteotomy and partial maxillectomy. Maxillectomy is nothing but surgical removal of maxilla. The next is 21050. It deals with condylectomy temporomandibular joint. Condylectomy is nothing but excision of condyle. The next is 21060. It deals with meniscalectomy partial or complete temporomandibular joint. Meniscalectomy is nothing but surgical removal of meniscus. The next is 21070. It deals with coronoidectomy. Coronoidectomy is nothing but surgical removal of mandibular coronoid process. The next is 21073. It deals with manipulation of temporomandibular joint therapeutic requiring an anesthetic service, especially like general or monitored anesthesia care. Now coming to head prosthesis. The codes 21076 to 21089 describe the professional services for rehabilitation of the patient with oral, facial or other anatomical deficiencies by means of prosthesis such as an artificial eye, ear or nose or intraoral obturator to close a cleft. Next coming to codes 21076 to 21089, they should be used only when the physician or other qualified healthcare professional actually designs and prepares the prosthesis. These codes should be assigned only when the physician or other qualified healthcare professional actually designs and prepares the prosthesis. They should not be prepared by an outside laboratory. Now coming to CPTs, the first one is 21076. It deals with impression and custom preparation of surgical obturator prosthesis. The next CPT 21077, it deals with orbital prosthesis. The next is 21076, it deals with interim arbitrator prosthesis. The next is 21080, it deals with definitive obturator prosthesis. The next is 21081, it deals with mandibular resection prosthesis. The next is 21082, it deals with palatal augmentation prosthesis. The next is 21083, it deals with palatal lift prosthesis. The next is 21084, it deals with speech aid prosthesis. The next is 21085, it deals with oral surgical splint. The next is 21086, it deals with auricular prosthesis. The next is 21087, it deals with nasal prosthesis. The next is 21088, it deals with facial prosthesis. Next is 21089. It is unlisted maxillofacial prosthetic procedure. The next is 21100. It deals with application of halo-type application for maxillofacial fixation, includes the removal. The next is 21110. It deals with application of interdental fixation device for conditions other than fracture or dislocation. It also includes removal. The next is 21116. It deals with injection procedure for temporomandibular joint orthography. Now coming to CPTs of repair, revision and reconstruction of head. The next CPT is 21120. It deals with genioplasty augmentation. Example, autograft, allograft or prosthetic material. The next is 21121. It deals with sliding osteectomy single piece. The next is 21122. It deals with sliding osteectomies, 2 or more osteectomies. For example, wedge excision or bone wedge reversal for asymmetric chin. The next is 21123. It deals with sliding augmentation with interpositional bone grafts. Genoplasty, these are all come under genoplasty codes. It deals with sliding augmentation with interpositional bone grafts. Includes the obtaining autografts. The next is 21125. It deals with augmentation, mandibular body or angle prosthetic material. The next is 21127. It deals with augmentation, mandibular body or angle with bone graft, onlay or interpositional. It deals with, it also includes obtaining autograft. The next is 21137. It deals with reduction, forehead, contouring only. The next is 21138. It deals with reduction, forehead, contouring and application of prosthetic material or bone graft. This also includes obtaining autograft. The next is 21139. It deals with reduction, forehead, contouring and setback of anterior frontal sinus wall. The next is 21141. It deals with reconstruction, mid-face, Le Fort 1, single piece, segment removal in any direction. Example for long face syndrome without bone graft. Next is 21142. It deals with reconstruction, mid-face, Le Fort 1, 2 pieces, segment movement in any direction without bone graft. The next is 21143. It deals with reconstruction, mid-face, Le Fort 1, 3 or more pieces. The next CPT is 21145. It deals with reconstruction, mid-face, Le Fort 1, single piece, segment movement in any direction requiring bone grafts. Includes obtaining autografts. The next is 21146. Here 2 pieces, segment movement in any direction, requires bone grafts, includes obtaining autografts. For example, ungrafted unilateral alveolar cleft. The next is 21147. Here 3 or more pieces, segment movement in any direction. This also requires bone grafts and includes obtaining autograft. The next is 21150. It deals with reconstruction, mid-face, Le Fort 2, anterior intrusion. Example, Treacher-Collins syndrome. The next is 21151. It deals with reconstruction midface Leaford 2 any direction requiring bone grafts. The next is 21154. It deals with reconstruction midface Leaford 3 extracranial any type requiring bone grafts. Includes obtaining autografts without Leaford 1. The next is 21155. Here with Leaford 1. Reconstruction midface Leaford 3 extracranial any type requiring bone grafts with Leaford 1. The next is 21159. It deals with reconstruction midface Leaford 3 extracranial and intracranial with forehead advancement requiring bone grafts without Leaford 1. The next is 21160. It deals with reconstruction midface Leaford 3 extracranial and intracranial with forehead advancement requiring bone grafts with Leaford 1. The next is 21172. It deals with reconstruction superior lateral orbital rim and lower forehead advancement or alteration with or without grafts. Includes obtaining autografts whenever performed. The next is 21175. It deals with reconstruction bifrontal superior lateral orbital rims and lower forehead advancement or alteration. Example is plagiocephaly, trigonocephaly, brachycephaly with or without grafts. The next is 21179. It deals with reconstruction entire or majority of forehead and or supraorbital rims with grafts. Example allograft or prosthetic material. The next is 21180. Reconstruction entire or majority of forehead and or supraorbital rims with autografts. Next is 21181. Reconstruction by contouring of benign tumor of cranial bones. Reconstruction by contouring of benign tumor of cranial bones. For example, in case of fibrous dysplasia, extracranial. The next is 21182. It deals with reconstruction of orbital walls, rims, forehead, nasoethmoid complex following intra and extracranial excision of benign tumor of cranial bone with multiple autografts. Total area of bone grafting should be less than 40 square centimeters. The next CPT is 21183. It deals with total area of bone grafting greater than 40 square centimeters but less than 80 square centimeters. Next is 21184. It deals with total area of bone grafting greater than 80 square centimeters. Now coming to 21188, it deals with reconstruction mid-faced osteotomies other than Leaford type and bone grafts. Next is 21193. It deals with reconstruction of mandibular rami, horizontal, vertical, C or L osteotomy without bone graft. Next 1194. 21194. It deals with bone graft. Reconstruction of mandibular rami, horizontal, vertical, C or L osteotomy with bone graft. The next is 21195. It deals with reconstruction of mandibular rami and or body, sagittal split without internal rigid fixation. The next CPT 1196. It deals with internal fixation. The next is 21198. It deals with osteotomy mandible segmental. Next is 21199. It deals with osteotomy mandible with genioglossus advancement. The next is 21206. Osteotomy maxilla segmental. The next is 21208. Osteoplasty facial bones augmentation. Example autograft, allograft or prosthetic implant. The next is 21209. Osteoplasty facial bone reduction. The next is 21210. It deals with graft bone, nasal, maxillary or malar areas. Includes obtaining graft. The next is 21215. It deals with graft bone, mandible. The next is 21230. It deals with graft rib cartilage autogenous to face, chin, nose or ear including obtaining graft. Next is 21235. It deals with graft ear cartilage autogenous to nose or ear. The next is 21240. It deals with orthoplasty, temporomandibular joint with or without autograft. The next is 21242. It deals with orthoplasty, temporomandibular joint with allograft. The next is 21243. It deals with orthoplasty, temporomandibular joint with prosthetic joint replacement. The next is 21244. It deals with reconstruction of mandible extraoral with transoccipital bone plate. Example, mandibular staple bone plate. The next is 21245. It deals with reconstruction of mandible or maxilla subperiosteal implant partial. The next CPT deals with complete reconstruction of mandible or maxilla subperiosteal implant. Complete is given by the CPT 21246. The next is 21247. It deals with reconstruction of mandibular condyle with bone and cartilage autograft. The next is 21248. It deals with reconstruction of mandible or maxilla endosteal implant. 21248. It deals with reconstruction of mandible or maxilla endosteal implant partial. Example, blade or cylindrical. The next is 21249. It deals with complete. Previous CPT was partial. Now 21249 can be given for complete. Next is 21255. It deals with reconstruction of zygomatic arch and glenoid fossa with bone and cartilage. The next is 21256. It deals with reconstruction of orbit with osteotomies with bone grafts. Extracranial with bone grafts. The next is 21260. Periorbital osteotomies for orbital hypertelorism with bone graft extracranial approach. The next is 21261. It deals with combined intra and extracranial approach. Periorbital osteotomies for orbital hypertelorism with bone graft combined intra and extracranial approach. Next is 21263. It deals with periorbital osteotomies for orbital hypertelorism with bone graft with forehead advancement. The next is 21267. It deals with orbital repositioning, periorbital osteotomies, unilateral with bone grafts, extracranial approach. The next is 21268. It combines intra and extracranial approach. The next is 21270. It deals with malar augmentation prosthetic material. The next is 21275. It deals with secondary revision of orbitocraniofacial reconstruction. The next is 21280. It deals with medial cantopexy. Cantopexy is nothing but a simple surgical operation that reinforces and stabilizes the canthal tendon. It can be medial or lateral, associated with lower eyelid interior components. Reinforces and stabilizes the canthal tendon is nothing but cantopexy. So medial cantopexy means reinforces and stabilizes the medial canthal tendon and associated lower eyelid interior components. The next is 21282. It deals with lateral cantopexy. The next is 21295. It deals with reduction of masseter muscle and bone. For the treatment of benign masseteric hypertrophy, extraoral approach. The next is 21296. It deals with intraoral approach. The next is 21299. It deals with unlisted craniofacial or maxillofacial procedure. By this we complete the revision, repair and reconstruction codes for head. Now coming to the CPTs of fracture and or dislocation of head. The first CPT is 21315. It is a revised code, hence it is indicated by triangle. Both 21315 and 21320 are revised. So the description of 21315 is closed treatment of nasal bone fracture with manipulation without stabilization. The next CPT is 21320. It deals with closed treatment of nasal bone fracture with manipulation with stabilization. The next is 21325. It deals with open treatment of nasal fracture uncomplicated. The next is 21330. Open treatment of complicated nasal fracture. with internal or external skeletal fixation. Next is 21335, open treatment of complicated nasal fracture with concomitant open treatment of fractured septum. When both open treatment of nasal fracture and septum are done, then you need to quote 21335. The next is 21336, open treatment of nasal septal fracture with or without stabilization. The next is 21337, the closed treatment of nasal septal fracture with or without stabilization. The next is 21338, open treatment of nasoethmoid fracture without external fixation. The next is 21339, it deals with open treatment of nasoethmoid fracture with external fixation. The next is 21340, it deals with percutaneous treatment of nasoethmoid complex fracture with splint, wire or head cap fixation, including repair or canthal ligaments and or the nasolacrimal apparatus. The next is 21343. It deals with open treatment of depressed frontal sinus fracture. The next is 21344. It deals with open treatment of complicated, that is nothing but comminuted or involving posterior bone. Open treatment of complicated frontal sinus fracture via coronal or multiple approaches. The next CPT is 21345. It deals with closed treatment of nasomaxillary complex fracture. Lee-Ford type 2 with interdental wire fixation or fixation of denture or splint. The next is 21346. It deals with open treatment of nasomaxillary complex fracture. Previously closed treatment, now open treatment. Lee-Ford type 2 with wiring or local fixation. The next is 21347. It requires open treatment of nasomaxillary complex fracture requiring open multiple approaches. Next is open treatment 21348. It deals with open treatment of nasomaxillary complex fracture with the bone grafting. The next is 21355. It deals with percutaneous treatment of fracture of malar area including zygomatic arch and malar tripod with manipulation. The next is 21356. It deals with open treatment of depressed zygomatic arch fracture. Example, Gillies approach. The next is 21360. It deals with open treatment of depressed malar fracture including zygomatic arch and malar tripod. The next is 21365. It deals with open treatment of complicated fracture of malar area including zygomatic arch and malar tripod with internal fixation and multiple surgical approaches. The next is 21366. It deals with open treatment of complicated fracture of malar area with the bone grafting. The next is 21385. It deals with open treatment of orbital floor blowout fracture, transantheral approach. The next is 21386. Here it uses periorbital approach. The next is 21387. Here it uses combined approach, that is transantheral and periorbital approach. Both are used in the case of 21387 to treat oral orbital floor blowout fracture. The next is 21390. It uses periorbital approach with alloplastic or other implant. The next is 21395. It deals with periorbital approach with bone graft. The next is 21400. It deals with closed treatment of fracture of orbit except blowout without manipulation. The next is 21401. It is used for closed treatment of fracture of orbit except blowout with manipulation. The next is 21406. It deals with open treatment of fracture of orbit except blowout without implant. The next is 21407. It deals with open treatment of fracture of orbit except blowout with implant. Now coming to 21408. It deals with open treatment of fracture of orbit except blowout with the bone grafting. The next is 21421. It deals with closed treatment of palatal or maxillary fracture. Lee-Fort 1 type with interdental wire fixation or fixation of denture or splint. The next is 21422. It deals with open treatment of palatal or maxillary fracture, Lee-Fort 1 type. The next is 21423. It deals with open treatment of complicated palatal or maxillary fracture, multiple approaches. The next is 21431. It deals with closed treatment of craniofacial suppression, Lee-Fort type 3, using interdental wire fixation or denture or splint. The next is 21432. It deals with open treatment of craniofacial suppression, Lee-Fort 3 type with wiring or internal fixation. The next is 21433. It deals with open treatment of craniofacial suppression, complicated by multiple surgical approaches. The next is 21435. It deals with open treatment of craniofacial suppression, complicated using internal or external fixation techniques. For example, head cap, halo devices, and or intermaxillary fixation. The next is 21436. It deals with open treatment of craniofacial suppression, complicated with multiple surgical approaches, internal fixation with bone grafting. The next is 21440. It deals with closed treatment of mandibular or maxillary alveolar ridge fracture. The next is 21445. It deals with open treatment of mandibular or maxillary alveolar ridge fracture. The next is 21450. It deals with closed treatment of mandibular fracture without manipulation. CPT is 21451. It deals with closed treatment of mandibular fracture with manipulation. The next is 21452. It deals with percutaneous treatment of mandibular fracture with external fixation. The next is 21453. It deals with closed treatment of mandibular fracture with interdental fixation. The next is 21454. It deals with open treatment of mandibular fracture with external fixation. Next is 21461. It deals with open treatment of mandibular fracture without interdental fixation. The next is 21462. It deals with open treatment of mandibular fracture with interdental fixation. The next is 21465. It deals with open treatment of mandibular condylar fracture. The next is 21470. It deals with open treatment of complicated mandibular fracture by multiple surgical approaches, including internal fixation, interdental fixation, and or wiring or dentures or splint. The next is 21480. Closed treatment of temporomandibular dislocation, initial or subsequent. The next is 21485. It deals with closed treatment of temporomandibular dislocation, complicated. For example, recurrent requiring intermaxillary fixation or splinting, initial or subsequent. The next is 21490. Open treatment of temporomandibular dislocation. The next is 21497. It deals with interdental wiring for condition other than fracture. Next is unlisted procedure 21499. Unlisted musculoskeletal procedure, head. Now let us discuss an example. Patient presents today for closed reduction of nasal fracture. Depressed right nasal bone was elevated using heavy reduction forceps while left nasal bone was pushed. Here manipulation is done and closed reduction of nasal fracture is done. So what is the appropriate CPT? The appropriate CPT is 21315, which is nothing but closed treatment of nasal bone fracture with manipulation without stabilization. Coming to next example, a surgeon performed a radical resection of both a malignant tumor from the soft tissue of the scalp and malignant tumor of mandible, and the bone graft was completed during the same surgical session to the mandible. So in total 3 procedures are done. First is radical resection of malignant tumor of scalp. CPT is 21015. Radical resection of tumor, soft tissue of face or scalp less than 2 centimeters. The next is 21045. Given by 59 modifier to indicate distinct procedure. Excision of malignant tumor of mandible, radical resection. The next is 21215 along with 51 modifier to indicate multiple procedures are done during the same session. So 21215 is given for graft bone mandible. So these are the three appropriate CPTs for the above scenario. Now coming to the CPTs of neck and thorax. First CPT is 21501. It is nothing but incision and drainage, deep abscess or hematoma, soft tissue, neck or thorax. The next is 21502. Incision and drainage, deep abscess or hematoma, soft tissue, neck or thorax with partial rib osteectomy. The next is 21510. It deals with incision deep with opening of bone cortex. For example, for treating osteomyelitis or bone abscess, thorax. The next is 21550. It deals with biopsy soft tissue of neck or thorax. Next is 21555. It deals with excision tumor soft tissue of neck or anterior thorax, subcutaneous less than 3 centimeters. The next is 21552. This is an out of sequence numerical sequence code, hence it is indicated by number sign. After 21555 you are giving 21552 and it deals with excision tumor soft tissue of neck or anterior thorax, subcutaneous 3 centimeters or greater. The next is 21556. Excision tumor soft tissue of neck or anterior thorax, subfacial, that is nothing but intramuscular, less than 5 centimeters. The next is 21554. This is also out of sequence code and it is indicated by number sign. Excision 21554. It deals with excision tumor soft tissue of neck or anterior thorax, subfacial. Example, intramuscular 5 centimeters or greater. The next is 21557. Radical resection of tumor, soft tissue of neck or anterior thorax, less than 5 centimeters. The next is 21558. Here, the tumor size is 5 centimeters or greater. The next is 21600. Excision of rib partial. The next is 21601. It deals with excision of chest wall tumor including ribs. The next is 21602. Excision of chest wall tumor including ribs with plastic reconstruction without mediastinal lymphectomy. The next is 21603. It deals with excision of chest wall tumor including ribs with plastic reconstruction with mediastinal lymphadenectomy. The next is 21610. It deals with costotransversectomy. Costotransversectomy, a separate procedure. The next is 21615. It deals with excision first and or cervical rib. Next is 21616. Excision first and or cervical rib with sympathectomy. The next is 21620. It deals with osteectomy of sternum partial. The next is 21627. It deals with sternal debridement. The next is 21630. It deals with radical resection of sternum. The next is 21632. It deals with radical resection of sternum with mediastinal lymphadenectomy. Now coming to the CPTs of repair, revision and reconstruction. The next is 21685. Hyoid myotomy and suspension. Next CPT is 21700. Division of scalenus anticus without resection of cervical rib. Next is 21705. Division of scalenus anticus with resection of cervical rib. The next is 21720. Division of sternocleidomastoid for torticollis, open operation without cast application. The next is 21725. It deals with cast application. Next is 21740. It deals with reconstructive repair of pectus excavatum or carinatum open. The next CPT is 21742. It deals with reconstructive repair of pectus excavatum or carinatum, minimally invasive approach. For example, NUS procedure without thoracoscopy. The next is 21743. This also deals with reconstructive repair of pectus excavatum or carinatum open with minimally invasive approach with thoracoscopy. The next is 21750. Closure of median sternotomy separation with or without debridement. Closure of median sternotomy separation with or without debridement is given by 21750. Now coming to fracture and dislocation codes of neck and thorax. The first one is 21811. Open treatment of rib fracture with internal fixation. Includes thoracoscopy visualization when performed unilateral 1 to 3 ribs. The next is 21812. Open treatment of rib fracture with internal fixation including thoracoscopy visualization when performed unilateral 4 to 6 ribs. The next is 21813. It deals with 7 or more ribs. Next is 21820. Closed treatment of sternum fracture. Next is 21825. Open treatment of sternum fracture with or without skeletal fixation. The next is 21899. Unlisted procedure, neck or thorax. Now let us discuss an example. A 73-year-old male presents with a neck mass to be excised. Neck mass was palpated and an incision was then made and carried down through the dermis with electroquartering. The subcutaneous tissue of the skin was open, encountering an organized mass with a benign appearance of lipoma. Using carefully blunt and sharp dissection, the mass measuring 5 cm was completely excised around its circumference, leaving the capsule intact. Entire circumference leaving the capsule intact. The mass was removed from its posterior attachments. Using electrocautery, what CPT should be reported for this procedure? Here, mass of neck is excised and the diameter is 5 cm. So the appropriate CPT is 21552. Excision tumor, soft tissue of neck or anterior thorax. Subcutaneous 3 cm or greater. Now let us discuss one more example. A 28-year-old slips in the bathtub, striking his right side on the edge of the tub. An X-ray is performed and shows open rib fractures 7 and 8. The ED physician provides open treatment of each fracture, both sides of ribs under thoracoscopic visualization. That is, rib fracture is done. How many ribs? 2 ribs and bilateral. Ribs of both sides are affected and thoracoscopic visualization is done. Additionally, provider provides patient education orders and incentives spirometer and provides the patient with a prescription for Pericote. So the appropriate CPT is 21811 along with 50 modifier to indicate bilateral procedure. 21811 is nothing but open treatment of rib fracture with internal fixation including thoracoscopic visualization when performed unilateral 1 to 3 ribs. Now coming to CPTs of back and flank. First one is 21920. It deals with biopsy soft tissue of back or flank superficial. Next is 21925. Biopsy soft tissue back or flank deep. Next is 21930. Excision tumor soft tissue of back or flank subcutaneous less than 3 cm. Next, if the tumor size is greater than 3 cm, it is given by the CPT 21931. Next is 21932. Excision tumor soft tissue of back or flank subfacial less than 5 cm is given by 21932, whereas subfacial 21933 is given for excision of tumor soft tissue of back or flank subfacial whenever the diameter is 5 cm or greater. The next is 21935. It deals with radical resection of tumor of soft tissue of back and flank less than 5 cm. Next is 21936 if the tumor size is 5 cm or greater. By this we complete the CPTs of back and flank in the musculoskeletal system. Now let us discuss an example. A 70-year-old patient presents for radical resection of flank mass measuring 6 cm. Radical resection is done and the diameter is 6 cm. So the appropriate CPT is 21936, which is given by radical resection of tumor, soft tissue of back and or flank 5 centimeters or greater. Thank you for watching. Please subscribe for further videos on medical coding and CPC training.